lapel.
Adrenergic system and drugs. Hey everyone! Welcome back to our channel. Today, we're diving deep into the fascinating world of the adrenergic system. If you've ever wondered how your body responds to stress or how certain medications work, you're in the right place. So, grab a snack, get comfy, and get started. First off, let's set the stage. The adrenergic system is part of the autonomic nervous system, specifically the sympathetic division. This is the part of your nervous system that kicks into gear during stressful situations. Think fight or flight. At the heart of the adrenergic system are three key players known as catecholamines: noradrenaline, adrenaline, and dopamine. Noradrenaline, or norepinephrine, is primarily a neurotransmitter that acts at postganglionic sympathetic sites. Adrenaline, or epinephrine, is secreted by the adrenal medulla and plays a role in both the brain and the body. Dopamine is crucial in the brain, especially in areas like the basal ganglia and limbic system, and it has some peripheral functions too. Now, how do these catecholamines come into play? They're synthesized from an amino acid called phenylalanine. The process kicks off with an enzyme called tyrosine hydroxylase. This is the rate-limiting step, meaning it controls how fast catecholamines are produced. If you inhibit this enzyme with a compound like alpha-methylptyrosine, you can actually deplete these catecholamines. This can be particularly useful in certain medical conditions, like pheochromocytoma, a type of tumor that can cause excess catecholamine production. So, now that we know how catecholamines are made, let's talk about where they're stored and how they're released. Catecholamines are stored in vesicles within adrenergic nerve terminals. When a nerve impulse occurs, these vesicles release their contents through a process called exocytosis. This release is tightly regulated by presynaptic receptors, particularly alpha-2 receptors, which can inhibit the release of norepinephrine. Interestingly, when these catecholamines are released, they don't just act alone. They can also release cotransmitters like enkephalins and neuropeptide Y, which can modify the response. Now, let's break down the actions of these catecholamines in the body. Adrenaline and noradrenaline have widespread effects. For instance, they increase heart rate and force of contraction in the heart. This is thanks to their action on beta-1 adrenergic receptors. In the lungs, they cause bronchodilation, making it easier to breathe. On the flip side, they can also cause vasoconstriction in certain blood vessels, which helps to redirect blood flow to essential organs during a stress response. You might be wondering, how do we use this information in medicine? Well, let's talk about some adrenergic drugs. Adrenaline is often used in emergency situations, like anaphylactic shock, to raise blood pressure and counteract bronchospasm. Noradrenaline is used as a pressor agent to treat severe hypotension, while isoprenaline is a bronchodilator used in asthma. These medications are critical in managing various conditions, from cardiac arrest to respiratory issues. But, like any medication, they come with potential side effects. For example, excessive doses of adrenaline can lead to increased blood pressure and heart rate, which might cause complications like arrhythmias. That's why it's essential for healthcare providers to carefully monitor their use, especially in patients with pre-existing conditions like hypertension or heart disease. So, to wrap up, the adrenergic system plays a crucial role in how our bodies respond to stress and how we can manage various medical conditions. Understanding this system not only helps us appreciate our body's incredible capabilities but also guides effective treatment strategies. Next, let's explore adrenergic drugs, also known as sympathomimetics. These medications play a crucial role in our body's response to stress and are essential in treating various medical conditions. So, let's break it down together. First off, what exactly are adrenergic drugs? Well, these are substances that mimic the action of the body's natural catecholamines, specifically, adrenaline, noradrenaline, and dopamine. These neurotransmitters are key players in the sympathetic nervous system, which is responsible for our fight or flight response. Adrenergic drugs can be classified into two main categories: direct-acting and indirect-acting. Direct-acting drugs bind to adrenergic receptors, while indirect-acting drugs stimulate the release of catecholamines or inhibit their reuptake. Now, let's take a closer look at the different categories of adrenergic drugs and their therapeutic uses. 1. Pressor agents. First up, we have pressor agents. These include drugs like noradrenaline and phenylephrine. They are primarily used to increase blood pressure during hypotensive states, such as shock. They work by causing vasoconstriction, which narrows the blood vessels and raises blood pressure. For instance, phenylephrine is often used in emergencies to manage low blood pressure. Just remember, these drugs can cause reflex bradycardia, which is a slowing of the heart rate. 2. Cardiac stimulants. Next, we have cardiac stimulants like adrenaline and dobutamine. These are crucial in situations like cardiac arrest or severe heart failure. Adrenaline not only increases heart rate but also improves blood flow to vital organs. Dobutamine, on the other hand, is more selective for beta-1 adrenergic receptors, primarily enhancing cardiac output without significantly increasing heart rate. This makes it particularly useful in managing heart failure. 3. Bronchodilators. Moving on, we have bronchodilators such as salbutamol and formoterol. These drugs are lifesavers for individuals with asthma or COPD. They work by relaxing the muscles around the airways, making it easier to breathe. Beta-2 agonists, like salbutamol, are commonly used as rescue inhalers because they provide quick relief from bronchospasm. 4. Nasal decongestants. Next up are nasal decongestants like phenylephrine and oxymetazoline. These work by constricting blood vessels in the nasal passages, reducing swelling and congestion. They're great for relieving symptoms of colds and allergies. But be cautious. Prolonged use can lead to rebound congestion, where your symptoms may worsen after stopping the medication. 5. CNS stimulants and anorectics. Now, let's talk about CNS stimulants, such as amphetamines. These drugs increase alertness and concentration, making them popular for conditions like ADHD. However, they come with risks, including potential for abuse and various side effects. So, they should be used under strict medical supervision. Side effects and contraindications. While adrenergic drugs can be incredibly effective, they also come with side effects. Common ones include anxiety, palpitations, and increased blood pressure. In some cases, they can lead to serious complications like arrhythmias or myocardial infarction, especially in patients with pre-existing conditions. So, it's crucial to use these medications judiciously and under medical guidance. Now let's look at adrenergic drugs, specifically focusing on their effects and applications related to women's health, particularly in the context of the uterus. First things first, what are adrenergic drugs? Well, these are medications that mimic the effects of the sympathetic nervous system. They're often referred to as sympathomimetics. Think of them as the body's natural stimulants, helping us respond to stress or emergencies. Now, when we talk about women's health, one of the key areas where adrenergic drugs come into play is in the uterus. These drugs can have significant effects on uterine muscle tone and contractions. For instance, certain adrenergic drugs, like ridodrine and terbutaline, are classified as selective beta-2 agonists. These medications are primarily used to relax the uterus during preterm labor. By stimulating beta-2 receptors, they help to inhibit contractions, essentially giving the baby more time to develop before birth. Imagine a scenario where a pregnant woman starts experiencing premature contractions. This is where these adrenergic drugs come in as a therapeutic option. They can be administered intravenously to quickly relax the uterine muscles, potentially delaying labor and allowing for safer delivery. However, it's important to note that while these drugs can be lifesavers, they're not without side effects. Some women may experience increased heart rate, anxiety, or even tremors. That's why healthcare providers carefully weigh the risks and benefits before prescribing them. But that's not all. Adrenergic drugs also play a role in managing conditions like dysmenorrhea, which is painful menstruation. Certain beta agonists can help alleviate the pain by relaxing the smooth muscles of the uterus. In addition, adrenergic drugs can also be beneficial in treating urinary incontinence in women. By increasing the tone of the vesical sphincter, these medications can help manage involuntary urination, which is particularly useful for women who may experience this issue postpartum or during menopause. So, to summarize, adrenergic drugs are a vital part of managing various conditions related to women's health. They help in relaxing the uterus during preterm labor, alleviating menstrual pain, and even aiding in urinary incontinence. As with any medication, it's essential to consult with a healthcare professional to understand the best options for individual health needs. And remember, while these drugs can be effective, they should always be used under medical supervision. Next, let's explore adrenergic drugs and their therapeutic classifications. First off, let's break down what we mean by adrenergic drugs. These are medications that mimic the effects of the neurotransmitters adrenaline and noradrenaline, which are key players in our body's fight-or-flight response. They interact with adrenergic receptors, which are found throughout our body, influencing various physiological functions. Now, adrenergic drugs can be classified into several therapeutic categories based on their primary uses. Let's go through each of these categories in detail. 1. Pressor agents. Starting with pressor agents, these drugs are primarily used to increase blood pressure. They're crucial in treating conditions like shock or severe hypotension. Some common pressor agents include noradrenaline, norepinephrine, often used in emergency situations. It helps to constrict blood vessels and raise blood pressure. Phenylephrine, this one is frequently used as a nasal decongestant and to manage hypotension. Dopamine, at low doses, it can enhance renal blood flow, but at higher doses, it acts as a strong pressor agent. These medications are essential in critical care settings where maintaining blood pressure is vital for patient survival. 2. Cardiac stimulants. Next up, we have cardiac stimulants. These drugs are used to increase the heart's contractility and improve cardiac output. They are particularly useful in conditions like heart failure or during cardiac surgery. Some key players in this category include adrenaline, epinephrine. This is a go-to for cardiac arrest situations. It stimulates the heart and can also help with severe allergic reactions. Dobutamine, this drug is more selective and primarily enhances the heart's contractility without significantly raising heart rate or blood pressure. It's often used in acute heart failure. These cardiac stimulants can be life-saving in critical situations. 3. Bronchodilators. Now let's talk about bronchodilators. These medications are primarily used to treat respiratory conditions like asthma and chronic obstructive pulmonary disease, COPD. They work by relaxing the muscles around the airways, making it easier to breathe. Some popular bronchodilators include isoprenaline. This drug is effective in relieving bronchospasm. Salbutamol and formoterol. These are commonly used for asthma management and provide quick relief from wheezing and shortness of breath. Bronchodilators are essential for anyone struggling with breathing issues. 4. Nasal decongestants. Moving on to nasal decongestants. These drugs help relieve nasal congestion caused by colds or allergies. They work by constricting blood vessels in the nasal passages, reducing swelling and congestion. Some examples include phenylephrine, often found in over-the-counter cold medications. Pseudoephedrine, this one is also widely used for its decongestant properties. While they provide quick relief, it's important to use them cautiously to avoid rebound congestion. 5. CNS stimulants. Next, we have central nervous system stimulants. These drugs enhance alertness and energy and are often used to treat conditions like attention deficit hyperactivity disorder, ADHD, and narcolepsy. Key examples include amphetamines. These increase dopamine and norepinephrine levels in the brain, improving focus and attention. Modafinil, a newer stimulant that promotes wakefulness with a lower potential for dependence. These stimulants can significantly improve the quality of life for individuals with these conditions. 6. Anorectics. Lastly, we have anorectics, which are used to suppress appetite and assist with weight loss. They work by enhancing the action of norepinephrine and serotonin in the brain. Some examples include fenfluramine. Although it was popular, it was withdrawn from the market due to serious side effects. Sibutramine, this drug was used for weight management but was also banned due to cardiovascular risks. It's crucial to approach the use of anorectics with caution and under medical supervision. So there you have it. A detailed look at the therapeutic classification of adrenergic drugs. These medications play vital roles in managing various health conditions, from cardiac issues to respiratory problems and beyond. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more informative content. And as always, if you have any questions or topics you'd like us to cover, drop them in the comments below. Thanks for watching, and we'll see you in the next video.
Pharma Pal.